Hello, coders. Hello, everybody. Hello, and happy Monday. As always, let me know if you guys can hear me in the chat, and then we will go ahead and get started on our class. Let me know how I sound. Okay, thank you so much. Thank you so much. All right, so like I said, hello everyone. Hello and welcome to another week of our ICD 10 CM Guideline Mastery sessions. I am Miss Haley. I'm going to be your lead instructor for this class, and I'm so excited to welcome new and returning coders to our Monday night class. And then also shout out to our interns, Miss Olga and Miss Vina, that are going to be in the chat and cheering you guys on and answering any questions that you guys have. So big shout out to them. I definitely could not do this Monday night class without them. So we are beginning week 4. I cannot believe that we are already in week 4. Time is just flying by. And today we are going to be going over and reviewing some endocrine, some mental health, nervous system, and eye disorder guidelines. As always, I'm going to be using our ICD-10 CM guideline book, and then I'm also going to be referencing our MCG manual as well in this session. So if you can, definitely make sure to have those handy because we're going to be referencing them a lot. And we're also going to be playing our, oh no. Did my mic cut off? I'm hearing 50% sounds good and 50% where did you go? So, oh no. I hope you guys can hear me. I'm just going to continue with my intro and let me know what's going on. What do you mean, no? Oh, okay. Thanks so much. I was like, oh no. Okay. So sorry for the wonky audio. Okay. Thank you so much. Perfect. I want to make sure everyone can hear me. Want to make sure. Okay. So, like I said, definitely make sure to have the ICD-10 CM book and your MCG manual as well. Make sure to have those handy. We're going to be referencing those a lot. And we are also going to be playing our Jeopardy game in the beginning with our true and false so that we can familiarize ourselves with these. It's going to be chapters 4, 5, 6, and 7 guidelines. And then that's going to be followed by some more in-depth scenarios so that we can fully master these ICD-10 CM guidelines. So without further ado, I'm going to go ahead and read this big long copyright right here real quick. All right. So ICD-10 CM copyright 2026, American Medical Association, all rights reserved. Fee schedules, relative value units, conversion factors, and or related components are not assigned by the AMA, are not part of CPT, and the AMA is not recommending their use. The AMA does not directly or indirectly practice medicine or dispense medical services. The AMA assumes no reliability for data contained or not contained. ICD-10 CM is a registered trademark of AAPC. AAPC content found within this presentation is copyright of AAPC. Keyword concept FTR, Chun, AMCI 57, AMCI ICD-10, Flip, TAP, and MCG are trademarks of AMCI. The credentials CPC, CRC, COC, CPMA, CPB, CPPM, CPCO are owned by the AAPC. AMCI does not own the rights to these credentials. The credentials CCA, CCS, CCS-P, RHIA, RHIT are owned by AHIMA. AMCI does not own the rights to these credentials. Whew. All right. I am in my 3rd trimester of pregnancy, so saying all of that really fast just knocks the breath out of me. So if I'm breathing hard, I'm so sorry. Okay, so we're going to warm up with our Jeopardy round, and I'm going to stop sharing my screen super quick so that I can grab that for you guys. So hold tight. And while I'm grabbing that game, as always, we're going to post our survey link in the chat. So if you have to leave early or if you have any questions that did not get answered by our wonderful team, definitely make sure to click on that and let us know how we're doing so that we can better make this class have as many, thank you so much, as much of a learning possibility for you guys so that everyone can just know and master all of those guidelines, because that's what we want. So if you have any questions, and definitely give us feedback how we're doing during our class. All right, so these are going to be our categories. I was able to split them up into the different chapters. So our chapters today, thank you guys so much. So our chapters today, we're going to be going over chapter 4, which is going to be our endocrine, our nutritional, and our metabolic diseases. This is going to be those E00 through E89 codes. Next, we're going to be doing chapter 5, mental, behavioral, and neurodevelopmental. This is going to be the F01 through F99. Then we're going to do chapter 6, diseases of the nervous system, which is G00 through G99. And chapter 7, the diseases of the eye and adnexia, which are going to be codes H00 through H59. And as always, if you guys are new here, all of the questions are going to be true or false. And then after this round, I have all of the questions, all of the answers, and all of the guidelines I specifically referenced so that we can look back if you guys need to get any more practice with those. So if you think I'm going kind of fast, I'll definitely go back and explain them so you guys can pause. This video is recorded, so if you need to look back, you can do that. All right, so without further ado, let's start off with a 100 to kind of warm up, and put your answers in the chat. These are all going to be true or false. So put those answers in the chat. Our first off is going to be true or false. Always code based on provider documentation, not assumptions based on age. So there's not a game code. Last time it was being a little funky, so I don't want to waste y'all's time with doing a live game code. So we're just gonna put I'm gonna investigate that. So maybe next time we can make it a little bit more interactive and have like a kind of competitive game on here. But for now, we're just gonna put all of our answers in the chat. And this is definitely a good warm-up question just to get the guideline juices flowing. And I'm getting a lot of responses in the chat. Great participation to start off the class. This, of course, is going to be true. Everyone got that one right. Great start. You definitely always code based on provider's documentation. That's pretty straightforward there. So that was a great start. All right, let's move on to a 200 from chapter 6, diseases of the nervous system. All right, so true or false? Pain codes from category G89, which are the pain codes, are not assigned if the focus is on addressing the condition rather than managing pain. All right, so again, this is going to be from our nervous system chapter. All of these are taken right out of the MCG manual. So let me know if this is a true or false statement. I'll give you guys a few seconds to think this one over. All right, great job, everybody. Yes, this one is going to be true indeed. Pretty much all the G89 codes are going to be, actually not pretty much, all of the G89 codes are going to be about pain management. So that's an easy way to just make this one true right off the bat. And so whenever you hear a G89 kind of category, that's what we're going to be referencing is pain management. So great job. Amazing start as always. All right, let's go a little difficult. Let's do a chapter 5. Let's do a 300. All right, this is kind of a long one. Okay, so true or false? Use psychoactive substance use disorder codes only when the provider documents the substance use and it's associated with a physical, mental, or behavioral disorder. So, when are we using the psychoactive substance use disorder codes? When are we going to be using those? Is this going to be true or false? I know it's a lot of words, so I'll give you guys a few seconds on this one. All right. I'm getting a lot of amazing responses in here. So, yes, this one is indeed going to be true. So, yes, we need all of the documentation to use these substance use disorder codes. So, that would make this statement 100% true. And I think everyone got that one right. So, that was amazing. Okay, let's move on. Let's do another chapter 5 for 200. Alrighty. So, when use, abuse, and dependence of the same substance are all documented, assign only the code for the highest level, and the highest level is abuse. Yes, you guys are rocking. Well done indeed. All right, so how are we coding for this one? Are we assigning the highest level, which is abuse? True or false? All right, for those that are putting okay, I'm getting a lot of I'm getting some responses. What else do you guys what makes this statement false? I know I'm being extra, but this is false. It is true. It's true that it's false. Oh my gosh. This statement is false. Yes, amazing. Indeed. So yes, so the guideline specifically says when use, abuse, and dependence of the same substance are documented, assign code for the highest level, but the highest level is not abuse, the highest level is dependence. You guys are really mastering. Oh my goodness. Wow. I am blown away. That is really awesome, everyone. Yes, so dependence is going to be the highest. Great job, everyone. All right, let's move on to chapter 7, diseases of the eye and anexia. Ooh, this is going to be a long one. Okay, so true or false? When a patient has a bilateral glaucoma and both eyes are documented as having the same type and the same stage, and there is a code available for bilateral glaucoma, assign the bilateral code for that type of glaucoma with the 7th character indicating the stage. So when someone has bilateral glaucoma, is this how we are coding it? True or false? Alrighty. Great job, great job. So yes, this one is indeed going to be true. If you have the bilateral code, you're definitely going to use it. It also states in that guideline that if there is not a bilateral code, that you're going to do a separate code for each eye. But if there is a bilateral code, you most definitely should be using it. All right. Let's go back to chapter 4 for 200. Okay. So, when the type of diabetes mellitus, when the type of diabetes mellitus is not documented, the default is E10 type 1 diabetes mellitus. True or false? All right, and we are getting an overwhelming false, as we should, because it is false. And I'm sure all of you guys put because you already know when the type of diabetes mellitus is not documented, the default is actually E11, and it's going to be type 2 diabetes, not type 1 diabetes. So good catch. Keep up the great work. Okay, let's move on to chapter 6, diseases of the nervous system for 300. Okay. Routine or expected post-operative pain immediately after surgery should be coded. True or false? Pain immediately after surgery should be coded. True or false? All right, amazing job. Good evening. Do not apologize for being late. We are we are happy to have you. Definitely do not be sorry. I know Mondays sometimes are Mondaying, that is for sure. Okay, so for this, indeed, it is false. The guideline specifically says routine or expected post-operative pain immediately after surgery should not be coded. Definitely, if something is going on or if there's pain a little while after, that's a different story. But pain right after surgery, that should not be coded. So great catch, everyone. I think everyone got that one right. I think you guys are just getting them all right. So just killing it. All right, let's do a 300 diseases of eye and adnexia. Okay, so for indeterminate stage of glaucoma, assign the seventh character 2 when clinical documentation indicates that the glaucoma stage cannot be clinically determined. So, what seventh character are we going to be using when clinical documentation indicates the glaucoma stage cannot be determined? Is it 2? Is that true or false? What do we think? And if you think it's false, what do you think it is? Oh my goodness, you guys knocked this one out of the park. I thought I was trying to be a little sneaky with this one because I just simply changed one thing. But you are right. This one is false. And some of you, a lot of you, went the extra mile and said what the seventh character was supposed to be. And you are indeed right. This is false because the seventh character should be 4 when the clinical documentation indicates the stage cannot be determined. It should be 4. You guys just knocked it right on the I don't even know what I'm trying to say. I'm just blown away by you guys getting that right. That was awesome. Okay. Let's let's go back to mental and behavioral chapter 5 for 100. All right. True or false? Moderate or severe substance use disorder in remission. You should code this as substance abuse in remission. True or false? What do we think, coders? All right, so this one I'm getting about a 50-50. So this one is going to be false. So I was trying to be a little sneaky. So if you look at the guideline, there is a way to code mild substance use disorders, and then there's a way to code moderate or severe substance use disorders in remission. So if it's a mild substance use disorder in remission, you're going to code it as substance use, or I'm so sorry, you're going to code it as substance abuse in remission. But if it's moderate or severe substance use disorder in remission, you're going to code it as substance dependence in remission. I'm seeing some people putting their explanations in there, and you would 100% be right. Yes, so that's the only thing that I changed right here. So because it is moderate or severe, instead of coding it as substance abuse, you would code it as substance dependence in remission. So if you got that one right, that was good because I was definitely trying to be a little sneaky there. So if you caught that and you put an explanation in the chat, that is amazing. Okay, let's do our 300 to get this one out from chapter 4. This is a long one. Okay, so true or false, diabetes mellitus code are combination codes that capture 3 key elements: the type of diabetes mellitus, the body system affected, and any complications affecting that body system. Is that a true or a false statement? What do we think, everyone? Right, absolutely. This one is 100% true. That is definitely what these diabetes mellitus codes are capturing, definitely capturing these 3 elements. And I think that everyone put true on this one, so everyone knows that this statement is correct. Perfect answer indeed. You guys are just knocking this out of the park. All right, we got 2 more left before we move on to our in-depth scenarios. Let's do chapter 7 for 200. Okay. So, true or false, assign as many codes from category H40, which is glaucoma, as needed to identify the type of glaucoma, the affected eye, and the glaucoma stage. True or false? All right, getting some great responses in the chat. Yes, so this is going to be true. There's not going to be a limit on how many codes, how many glaucoma codes that you use. So definitely make sure to use all the ones that you need to identify the type, the affected eye, and the glaucoma stage for sure. Everyone got that one right yet again. All right, and then this is going to be our last one for our Jeopardy game. Let's end on a great note. You guys have been killing it so far. Okay, so true or false? Default to dominant for left side and non-dominant for the right side. Again, this is going to be, what are we using the default when we're coding side? True or false? All right, I thought I could trick you guys for the last question, but absolutely not. Every single person put an outstanding false, and that is correct. It would be false. And I know the chat is on fire. I agree. So, yes. So, you guys know, because everyone put false, the default for your dominant side is going to be right side, and the non-dominant is going to be the left side. So it's totally opposite. So that is what makes this question false, and everyone got that one right. That was an amazing end to that game. You guys, that was like the best I've ever seen anyone do these questions. That was very impressive. I hope you guys are happy with your performance with that. I'm going to stop sharing my screen really quick, and I'm going to move back to our PowerPoint just so that I can go over quickly what the questions and the answers were. If anyone needs to go back through, I'm just going to click through them kind of fast. But if you need to look back over them, these are going to be recorded, so you can pause whenever you need to and look over these specific guidelines. So for our chapter 4, endocrine, nutritional, and metabolic disease, these are all the questions that I asked. These are all of the answers. And then this is going to be these specific guideline. This I'm referencing the MCG manual, but they're obviously also going to be in your ICD-10 manual as well. So this is what makes them true and false. All right, moving on. Chapter 5, mental, behavioral, neurodevelopmental. Question, answer, and the guideline. For chapter 6, diseases of the nervous system. This is going to be the the question, answer, guideline, and then so we have two versions of our live class. They're right next to each other. One version is for if you are on a computer or a laptop, and then one is for if you are on the phone version. If you're on your laptop and you click on the phone version, a lot of times the font is super small. So I would suggest exiting out, and the videos are right next to each other. but one has a little phone icon next to the title. So if you click on the yes, so sometimes yeah, it's the same video. It's just one is for a phone screen and one is for a computer screen. And so if you're on the computer looking at the phone screen one, sometimes the font is super duper 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 small. So I would suggest switching to that other video. They should be right next to each other, both in the live section. All right. So how are we feeling? Are we ready to move into some in-depth scenarios? If I were you guys, I would be feeling amazing because you guys killed that. So I am going to stop sharing. I'm glad that that worked. Okay, so, oh no, I didn't realize a lot of you guys were struggling with the small font. Okay, so I am going to stop sharing my screen and I'm going to grab our Quizlet so that we can start our in-depth scenarios. And again, if you are new, we have a scenario, a real life scenario, and we're going to break it down into our code words, or keywords rather. So we're going to break it down into keywords, and then the guideline we're going to use, and then we're going to switch it into actual ICD-10 codes, and then we'll go over it all at the end so it all makes sense. Okay, so, alrighty, so this is going to be our first scenario for tonight. As always, put your answers in the chat. So a patient with type 2 diabetes mellitus presents for management of diabetic nephropathy. The nephropathy has been confirmed by lab results and is documented as a complication of diabetes. The provider adjusts the patient's insulin regimen. Of the following not of the following answers, what keywords best describe this encounter? I'll give you guys a few seconds to put those in the chat and then we'll go over it. All right. Indeed. If you guys are still typing, definitely put those answers still in the chat. But yes, the keywords that we are going to be focusing on, which pretty much everyone put in the chat, are going to be that type 2 diabetes mellitus, the diabetic nephropathy, and the insulin use. So if you put that in the chat, great job. All right, now we are going to be moving on. This is going to be the same scenario using those keywords. What specific guideline from our manual are we going to be using to find the best codes? And so this is going to be from our chapter 5 codes, just to kind of narrow it down a little bit. That endocrine section that we were just going over, that is what we're going to be using to find the specific guidelines. So I'll give you guys a few seconds with that one. All right. I don't know why I said chapter 5. I apologize. Obviously, you guys didn't listen to me. I'm glad that you didn't because it is from chapter 4, the endocrine section, and it is going to be the IC4A6, which the specific title is going to be diabetes mellitus, secondary diabetes mellitus. So if you got that one right, outstanding. I always struggled with finding the specific guideline. So if you got that one, great job. All right. And then finally, the last part of this scenario, using those code words and using that guideline, now we are going to find these specific codes. So it's the secondary because it says type 2 diabetes mellitus. So we are going to be doing secondary. So it's just like type 2 diabetes, not like secondary code. Um, yes. So now we are going to put this all together in a great coding soup. And what specific ICD-10 codes are we going to be coding? Let me know in the chat. Okay. So I'm seeing all of you guys in the chat, and I looked over the MCG manual, and I don't, and I agree with you guys. I agree with you guys. I do not know why that is in there, because that would be the correct. Hold on, give me a second. Because I agree, because it is not secondary. It would be coded first. You guys are not wrong. All right, pause. Because I believe that it would be the IC4. A3 would be a better guideline for that because we are using our insulin and we are also using, okay, I fixed it. Everyone, hold on. Okay, let me stop sharing my screen for a second and switch over to the PowerPoint. Okay, I don't know why that would be on there. Strange, strange. Well, good catch, everyone. Okay, so Let me start sharing my screen again. Okay, so yes, so this should be the guideline, IC483. So instead of it being secondary, because it's not secondary, it should be diabetes mellitus and the use of insulin, oral hypoglycemic, and injectable non-insulin drugs. It would be that instead of the six, because I don't know why it said secondary. I'm so sorry about that, guys. My apologies. So, as we said, our keywords are going to be the type 2 diabetes mellitus, the diabetic nephropathy, and the insulin use, and with some investigative coding. I'm glad that you guys caught that. I don't know why that's on there. So, yes, so that is going to be the correct code, or the correct guideline is going to be IC483, because our diabetes, although it is type 2, that's the first thing that we're going to be focusing on. So this is how we're going to sequence it. So if you look at this right hand aisle right here, this column, our first is going to be a code from E11, which a lot of people selected. So the E11 code that we are specifically going to be focusing on is E11.21. So that is going to be type 2 diabetes mellitus with the diabetic nephropathy. So that accounts for the type 2 and the nephropathy, which are the keywords that we are focusing on. And then right here, it also says that we need a code from Z79 to account for the use of insulin. So our next code from Z79 is specifically going to be Z79.4, which accounts for long-term or current use of insulin, which I believe that everyone had the chance to put that in the chat. So if you did, and if you helped catch that, then amazing job. Yes, this definitely should be, my apologies, this definitely should be the right guideline used for sure. So if you got that right, amazing job. Amazing, amazing. Okay. And I'm going to go to our next scenario and we will work on that one. Okay. So our next scenario, and we're going to start back with doing the keywords. So, a patient with chronic back and neck pain developed a drug dependency on oxycodone, which is an opioid. After being taken off the drug, he was seen in the clinic for withdrawal symptoms. So, what keywords are we going to be focusing on in this scenario? All right, we got some fast typers in here. So yes, so we should be focusing on the drug dependency on oxycodone, which is the opioid, and the withdrawal symptoms after being taken off of the drug. All right, great job. All right, now we are going to be focusing on our guideline. This is going to kind of be a difficult one because this is actually a guideline from chapter 19. So that is going to be the guideline that we're going to be focusing on. But I'll still give you guys a few seconds and then I'll go over it and then we will focus on the codes. All right, and this is going to be a little bit of a more difficult guideline to find, so I'm just going to get right to it because you could probably see one that is in the chapter about mental health, but the one that specifically we're looking at is going to be IC19E5A, which is going to be adverse effects. Poisoning, underdosing, and toxic effects that occurrence of drug toxicity is classified in ICD 10 CM as followed of adverse effect. So this is going to be focused on the adverse effect of drugs, and that's because he was diagnosed the oxy and then he got addicted to it, and so that is why we are using this specific guideline. All right, and then next we are going to put it all together. What ICD-10 CM codes are we going to be using for this scenario? Amazing job if you got that one in the chat. Great job. All right, if you are still working on this, then keep going. I'm not going to give away the answer just yet. I'm just going to move to our PowerPoint so we can see how everything looks all together. All right. Oop. Okay, so obviously this is a scenario. I won't read it for the millionth time, but the keywords, like we said, we were going to focus on are the drug dependency on oxycodone and the withdrawal symptoms after being taken off the drug. So then we're going to move on. This is going to be the guideline we're going to be using. This is just a little bit more specific than something you would see in the mental health chapter, especially for this scenario specifically. So it's going to be IC19E5A, so adverse effects. And the reason that we are coding for an adverse effect is because the patient took the medication for a therapeutic reason, which led to a drug dependency, and that makes it an adverse effect. So because of that, we're going to be using this guideline. And then when you look at this, as always, if you look at the right side column first, it is going to ask you to list the adverse effect. And so that leads us into our first code. Our first code is going to be F11.23, which is going to be opioid dependence with withdrawal, because again, that is going to be a keyword that we took out of the scenario. So that's what makes that first code correct. And then if you go back to this column right here, it says to code from a category T36 through T50. So if you go into your tabular list in your ICD-10 CM manual, you will be able to, or you can look at the table of drugs as well. So if you look at the adverse effect, it'll take you to code T40.2x5. So this is going to be adverse effect of other opioids. And then if you see right here on the left, it's indicating that we need to use a seventh character. So if you look up above this code, it gives you this box right here. The appropriate seventh character is to be added to each code from category 2. So you have to use the A, D, or the S. And since this is an initial encounter, we are going to be using A as our seventh character. So the final sequence is going to be F11.23 and T40.2x5A. So if you got that one right, outstanding. Hopefully the explanation helped just a little bit, but everyone put in a great effort on that one. That one was a little hard. That one was a little bit hard, yeah, but I thought we would go in depth with some of these, but yes, definitely this guideline helps. And that is why we are choosing to do the adverse effect again, because he was taking the opioid for a therapeutic reason and it led to the drug dependency. And so that's what makes it the adverse effect. All right, so we are going to move on. The adverse effect was him developing the drug dependency. That was the adverse effect. Yep. So he used it for his chronic neck and back pain, and then the adverse effect would be the drug dependency. All right. I am going to switch back and we are going to focus on our last scenario of the night. All right. Here we are. Okay, so we are going back to our keywords. So, a 25-year-old OB patient with gestational diabetes and 29 weeks pregnant arrives for a routine prenatal visit. The patient's blood sugars are normal. The patient uses insulin and diet to manage her blood sugars. What keywords can we take out of this scenario? Let me know in the chat. All right, indeed. So, yes, so gestational diabetes is definitely a focus, 29 weeks, and the use of insulin and diet to manage blood sugars. So, that is going to be what we're going to focus on for that. And the next, we are going to be focusing on what guideline. So, this would be a chapter 4 because we are going to be focusing on endocrine with the diabetes. But if you do look in the section, especially in your ICD 10 manual, it tells you that all pregnant and gestational diabetes, that you should look at chapter 15. It takes you to that. So this is going to be, you're going to have to go to chapter 15 to find this guideline. So I don't want to lead you guys in the wrong path. So I'm definitely just going to give you a clue for that. If you're looking at gestational diabetes, you want to automatically go to chapter 4 because that's where you would find all your diabetes codes. But if you look on there, it directs all gestational diabetes and pregnancy within diabetes within pregnancy to be focused on chapter 15. All right. So, yes, a lot of people put the right guideline in there. So, yes, it is going to be IC15I. So, that is going to be gestational or pregnancy induced diabetes. So, if you put that in there, great work. And then we are now going to move on using those keywords and using that guideline from chapter 15. What ICD-10 CM code or codes best describe this encounter? All right, as always, if we are still working, please go ahead and do so. I'm just going to switch over to our PowerPoint one last time so that we can go over this scenario. But I'm getting a lot of great participation so far in the chat. Okay, so again, for this scenario, we are going to be focusing on our gestational diabetes, 29 weeks, and our use of insulin and diet to manage blood sugars. So this leads us to our first guideline. It's going to kind of be a long guideline, so I just clipped it right here. Our IC15I, our gestational or pregnancy induced diabetes. So the first code that it tells us to focus on is going to be 024.4, gestational diabetes, or these other codes 024.414, 424, 434, gestational diabetes, if patient uses insulin or controlled by diet. Now, this is definitely something that we should focus on because, again, looking at our keywords, it definitely says use of insulin and diet to manage blood sugars. So if you keep going further down this right hand column right here, it tells you gestational diabetes controlled with diet and insulin. And if you see that, it indicates for you to code only for the insulin. So you're going to be using code 024.414. So that is the code that we are going to use, 024.414, gestational diabetes mellitus in pregnancy, insulin controlled. And then you're going to go back to see what we're going to be coding second. In coding second, we're going to be coding our week's gestation, so a Z3A code. And then looking back at our keywords, we see that it's 29 weeks. So then we would go back to our ICD-10 and we would find our code Z3A.29, which is 29 weeks of gestation in pregnancy. So these would be our codes, and that is how they would be sequenced. All right. Hopefully, the explanation made sense. I know a lot of people were definitely on the right track with that one. So, hopefully, that scenario made sense. Everyone did an awesome job putting their answers in the chat. So, definitely great work with that one. All right. And that concludes our class. We ended right on time. So I know that some people had some questions about maybe the second scenario. I hope that the explanation helped. But if you do have any further questions about that scenario, any scenarios, or anything that we discussed in class today, definitely make sure, again, to click on that link and ask the question, and I will look over all of them tomorrow. So I will get back to you guys, answer any questions that you guys may have, let us know how we're doing. I definitely appreciate everyone attending. I definitely appreciate my team, Miss Olga, Miss Vina. You guys are great as always. And I hope that everyone has an amazing rest of their night. You guys did awesome. I absolutely love the participation as always in the chat, and keep it up. And I hope to see you guys next week for our week 5. The link is located, you can find it in the chat. It's just a little bit up. If you scroll up, the link will be posted right there. And we'll post the link in the description as well to the survey. So definitely make sure to fill that out. And I hope to see you guys next week for week 5. Everyone have an amazing rest of their day.
4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at AMCI. We're on the East Coast, the West Coast. We're all around.